Well, data shows RSV rates are rising in the province, and many of us may not be taking it as seriously as we could be. Infectious disease expert Dr. Oscar Larios joining us this morning. Dr. Larios, thanks for taking time. And if we can just start with an update on the general state in the province in terms of seasonal illness, because anecdotally, it seems like a lot of people are sick right now.
You're absolutely right, Jefferson. I know it seems that way, and it is also seeming that way for us in hospital. And actually, if you go to the Alberta dashboard where you can see all the respiratory viruses and their activity, we are certainly in the thick of things and are in the upswing as well. So it's probably going to get worse before it gets better.
Yeah, and I think we've got some visuals of that data. If we can just bring that in, guys. Let's get into these RSV cases specifically. How are we looking in the province right now?
So far, the last time I checked, I think we're at about 296 cases, and we've got to remember that this is just a fraction of the people that actually are infected. These are just people who are tested. There's been about 125 hospitalizations, 8 ICU admissions, and 2 deaths so far. This is just for RSV, so that's not including all the other respiratory viruses.
Okay, and let's just get a little bit of a reminder about RSV. There are obviously a number of people that are in specific risk. So talk a little bit about who is at most risk.
Yeah, so either the very young or the very old are at risk. And when I say very old, I use the term loosely. So anybody 50 and over who has any sort of other medical conditions, such as cardiac conditions, respiratory conditions, definitely should speak to their family physician or healthcare practitioner about potentially getting vaccinated. And then if you're 75 and older, you definitely should be getting a vaccine. If you're 60 and older and live in a continuing care facility or are Indigenous, you probably should also be getting a vaccine as well. So those are probably the really high risk groups that I would focus on.
Yeah, and there is some data out there suggesting that perhaps especially seniors might not be taking this seriously enough.
Yeah, there is. There's a recent study that's actually been done that shows that about 65% of people have never actually spoken to their healthcare practitioner about RSV. And as I've kind of alluded to, it can be a very serious illness. There is a vaccine to prevent it. And so it should be something that should be discussed with a healthcare practitioner, absolutely.
Okay, and outside of the vaccine, anything else we can be doing to protect ourselves, I guess, from any of these things that are flying around right now?
Yeah, I think common sense, social distancing. I know we don't like to talk about that, but, if somebody's sick, maybe keep your distance from them if they're obviously sick. If you're sick, stay at home. Good hand hygiene after you blow your nose, particularly. Those types of things will prevent, the spread of all these viruses for sure.
Okay, great information, and we appreciate your time this morning. That is infectious disease expert Dr. Oscar Larios.
Thanks so much.
Thanks.